it's Maddie. Welcome back to my channel. And today's video, I'm just going to be kind of sharing what I kind of know so far about oral health and the relationship to diabetes. This is my career path. I'm studying to be a dental hygienist if you've just joined my channel, but obviously not taking any dental courses yet. What do I already know in relationship to oral health and diabetes? So first of all, oral health is very important no matter if you have diabetes or not, because if you do not remove the gross plaque and bacteria and food residue that is sitting in your mouth, it can create a bunch of growth and can cause obviously your teeth to decay and deteriorate and cause wreak havoc on your gums, which can lead to gingivitis, periodontal disease, so on and so forth. So it's very important no matter if you're diabetic or not. First of all, brush your teeth at least twice a day and floss at least once a day minimum. And there's definitely proper ways to do it, and I do it fairly properly, but I hope to be learning more skills as I go into my dental hygiene career, because this is what my career is focused on, is professional teeth cleaning. And I just kind of want to learn these skills, and this is obviously my career path so that I can have better health and maybe oral health and deliver that best oral health to you. But if you have diabetes, and in particular type 1 diabetes, if you consistently have high blood sugars, that can actually do a damage to your oral cavity. When you consistently have high blood sugars, you actually have more bacteria present in your mouth, which can lead to tooth erosion, tooth decay, more cavities, and gum or gingiva erosion, which can lead to the gums actually receding from your teeth and causing periodontal disease. And then you'd have to see a periodontist or an oral surgeon to kind of get gum put back on your teeth, or have gum kind of taken from the roof of your mouth and put on the teeth that have been eroded away. So it's very important that you keep your A1Cs as good as possible. Now, obviously, I think we do learn about diabetes in my career, because obviously I might be dealing with patients that have type 1 diabetes, type 2 diabetes, maybe other types of diabetes. And I know when I went to my first dental appointment after I was diagnosed, they asked what my A1C is, how many units of each insulin I take, just some very basic information. But they were overall pleased with an A1C, even in the low 6s that I had at the time. But my A1C is currently 5.8. Dexcom and my continuous glucose monitor and my meter are predicting 5.6 or 5.7 for my next one. So at least my blood sugars aren't consistently high, which is doing better for my oral health. And one of the signs I had before I was diagnosed was having like swollen gums and bleeding gums. And that actually, like I said, has to do with your high blood sugars, which are kind of creating more bacteria and creating more of a imbalance in your mouth and in your saliva. So you're going to be prone to having problems. And if you don't take care of your teeth, it can actually lead to heart problems. So if you have diabetes and you're not taking care of your diabetes, plus you have are not taking care of your teeth or your mouth, you're probably going to end up with heart disease in the long run. They do correlate. The amount of plaque and bacteria that sit in your mouth and the health of your mouth mirrors what happens inside the rest of your body. The mouth is a huge window to show you what else is going on in the body. It can pinpoint to heart problems. And like I said, if the hygienists that had cleaned my teeth would have noticed that I had super dry mouth, or said maybe you should go see a doctor, your gums are swollen, this doesn't look normal, your mouth shouldn't be this dry, etc., etc. Maybe I could have caught my type 1 diabetes before I went into severe DKA and ended up in ICU. Maybe I would have just ended up in regular emergency room, or they would have just, oh, your blood sugar is 250, you have diabetes, we're going to send you home with insulin and give you the type 1 diabetes test, and that's it. It could have saved me a lot of chaos. So, type 1 diabetics are more prone to periodontal disease, cavities, tooth erosion, tooth decay, if the blood sugars aren't maintained at a healthy level. I would definitely stick with the ADA's guideline with being less than 7% for your A1C, but also shoot for less than that. My eye doctor says less than 6.5%, and I believe less than 6% is going to really minimize them complications that can happen in your mouth, with your nerves, your eyes, everything else. So keep your A1Cs in check, consistently brush your teeth, and be sure when you're brushing that you're getting up where the gum and the teeth meet, because that is where the most bacteria can kind of get stuck. So if you don't brush where the gums, say that the purple nails are my gums and then this is a tooth, if you don't get up there, actually bacteria and food particles can enter up there and obviously cause cavities and tooth decay, that you can't see unless an x-ray is taken or unless we probe you for periodontal disease. That's something that we can't figure out unless you take care of it in the first place. And if you're not flossing your teeth, please do floss your teeth. I have a great analogy for you what flossing your teeth is not. If you don't floss your teeth, it's like wiping your butt cheeks and not cleaning out the crack. I'm not even kidding you. Because food particles get stuck not only on the surface of the teeth and on the chewing part, they also get caught in between. So if you're not appropriately getting floss in between and going down below the gum line and rubbing against each side of each tooth, so each tooth has a side and another side, so you got to make sure you go down. Don't go in and out. Go down one side, come out, and go down the other side and come out. You'll be amazed how much food particles you get out. And you need to be doing that in order to avoid getting cavities that are deep or that could only be seen on x-rays. You need to be doing that to keep your gum health up, and you need to be doing that to keep the number of bacteria down in your mouth. Because if you have type 1 diabetes, you're more prone to high blood sugar, which in turn makes you more prone to having bacteria in your mouth. So if you do every preventable measure possible to keep your bacteria levels down normally, your chances of getting problems are pretty minimal. I actually had a filling put in, and it wasn't even a cavity. They just filled it because I had these stands on my teeth from braces. I had braces like over 6 years ago. I'll save that story for another day, how my braces experience went, because I think that would help a lot of people, how I kept my teeth so nice. This was the 5th filling I've ever had in my life. I've had 4 other fillings before when I was real little, and obviously when you're real little, you're not properly taking care of your teeth as well. But they filled this particular tooth back in February, or this part of this tooth. It was very shallow, only because it was beginning to get soft. And I was almost wondering if it's because my body was still in shock from the high blood sugars, if that didn't cause more bacteria buildup and more decay on that particular weakened area already. So that's filled. I've never had any problem since. But if your doctor or your dentist do recommend it, go to the dentist more than 2 times a year. Maybe you want to go every 4 months or every 3 months. I do only believe insurance plans only cover once or twice a year. My insurance covers twice a year, but I think if you're on Medicare, I think it's only once a year. I'm not 100% sure. Don't quote me on it. But if you have to go in more than the typical 1 or 2 times a year, do so to keep your health up, because it's extremely important that you keep your oral cavity good, because it's going to mirror what else is going on inside your body. And the tongue tells a whole story too. So if your tongue is funny colors, like I had a funny colored tongue when I was in the getting my teeth cleaned right before I was diagnosed with type 1 diabetes. Come to find out that was a yeast infection. I wish the hygienist would have said your tongue is a funny color. And that is something I'm going to be sure that I focus on when looking in people's mouths. If I notice anything unusual, I'm going to either tell my patient to go see a doctor or have the dentist take a look and maybe figure out if it's something more oral related or if it's an outside health problem. Because like I said, I could have had my type 1 diabetes diagnosed before I got so severe that I ended up in severe DKA and nearly dead or in a coma. And severe dehydration, that I said. I already shared my diagnosis story. I won't go too much into that. But anyways, I kind of wanted to share the basic insights I have so far on what oral health and diabetes are related to each other. They are extremely related. Like I said, your oral cavity and what goes on inside your mouth is a huge window and a huge opening to what the rest of your body actually feels like and what you're going through. They even say like looking at somebody's eyes or skin complexion can also give a huge sign of what's going on inside your body, because if your externals aren't healthy, chances are your internals aren't very healthy. So anyways, I hope you enjoyed this video, and as I learn more about the relationship between oral health and diabetes as I go further in school, I will be sure to update you with more scientific and technical knowledge. But this is the basics that I do know, and I hope you enjoyed this video. If you did, give it a big thumbs up. Feel free to hit that subscribe button down below. I post videos every single week about diabetes plus more. And stay tuned for tomorrow's video. I think you're really going to like it. I'm going to be delving into the different types of insulins and what their jobs are. So I hope you enjoy that, and until tomorrow for another video, take care, God bless, be kind, spread positivity, and be thankful. Bye everyone.